scientists have created a robot that is implanted into the body to treat a rare birth defect which prevents food reaching a baby's stomach. It occurs when the upper and lower parts of the esophagus don't connect, which means food can't pass from the throat to the stomach. Doctors currently treat the condition using the Foker technique, which involves pulling slightly on the broken ends of the esophagus to encourage them to grow towards each other. She said, doctors have been performing the Foker procedure as they realized that tissue lengthening can be achieved by pulling on the tissue. However, it is unknown how much force should be applied to produce tissue lengthening. Although the technique is one of the best standards, sometimes the sutures surgeons attach to the esophagus can tear, which can result in repetitive surgeries, or scar tissue can form that can cause problems for the patient in the future. Doctors can then monitor the patient without impacting on the baby's routine.The study suggests that with this robot, babies would be free to move around and be allowed to interact with their parents while undergoing treatment, taking away some of the stress from both parties. Dr. Damian added, "The biggest challenge we faced was to design a robot that works in a technology-hostile environment and to develop a robust physiologically relevant interaction with the tissue that promotes its growth when there are so many unknowns about the underlying mechanisms." The robot we designed had to be soft and durable, air and water impermeable, abrasion resistant, non-corrosive, and be able to be implanted for long-term treatment. It is shown cells will multiply in response to being pulled, rather than stretching out of shape or scarring. Using the robot's monitoring and control abilities, the treatment can be changed to suit the patient and to optimize the cell's growth. Professor Sheila McNeil, professor of tissue engineering in the Department of Materials Science and Engineering at the University of Sheffield, said, increasing knowledge of how tissues respond to mechanical strain with the production of new tissue has been needed for a long while. Doctors and researchers understand that tissues will normally grow in response to traction forces. For example, this occurs naturally during pregnancy as the growing baby increases the pressure inside the mother. The abdominal wall and skin increase in area to relieve the tension generated from stretching these tissues. Plastic surgeons have copied this trick by placing an inflatable balloon under the skin and inflating it over a period of weeks to expand skin, and they then use this extra skin for reconstructive surgery for the patient. The development of this robotic implant is a breakthrough in applying the knowledge that tissues respond to strain with the production of new tissue in a practical and clinically useful manner.